A very good morning to you and welcome. Thanks for joining us for House Calls, Real Docs, Real Talk. I'm your host, Nancy J. Now, today, it's all about cholesterol. What is it exactly and how do you manage it? We're going to answer all of your burning questions. But first, don't forget to hit your share button and let your friends and family know you're watching. A lot of us deal with some form of cholesterol issue, so let's pass the information along. Also, throughout the show, we're going to ask you to get involved by answering a few viewer questions. To respond, so easy. All you have to do is text AHA Live to 22333. Now, we won't ask for your name or your any personal information, so if you don't want to text in, you can also participate by simply dropping your answer in the comments section. So let's get started. With me this morning, a big welcome to Dr. Marlene S. Williams, Clinical Director of Cardiology, Johns Hopkins Bayview Medical Center, Associate Professor of Medicine, the Johns Hopkins University. Welcome, Dr. Williams. How many times do you have to give your full title every day?
Not every day, thankfully. And thanks for your welcome, Nancy. I'm very happy to be here today.
I'm thrilled to have you here because cholesterol is something that affects, I think, every single one of us in some form or fashion. So let's start our conversation with our first viewer response question. True or false? Eggs are high cholesterol foods that should be avoided. The egg. Now, I love eggs. Dr. Williams, yay or nay?
Okay, I'm going to straddle the fence with this, and I'm going to say true, it is a high cholesterol food, but false, it should not be avoided. And the reason is because what we've seen this over the years is that we used to think that lots of eggs would, increase your cholesterol. And it turns out it's probably the other food that we add with the eggs, the bacon, the sausage and stuff, that actually contributes to the elevated levels of cholesterol. And eggs themselves, within the yolk, that's where most of the cholesterol is. But the white is actually very high in protein and has no cholesterol whatsoever. And so it really doesn't need to be avoided. Everything in moderation is key. So we probably shouldn't be eating them, frying them every single day. But, a few eggs a week is probably quite fine.
Well, we must have some egg eaters who are our viewers because 67% says that it's false that high cholesterol food such as an egg doesn't have to be avoided. So as long as we just eat the white, right? I mean, that's easy.
Yes.
Okay. Well, let's move on and get started with health in the headlines. Each week, we select one current headline that ties back to the topic at hand and ask our expert to respond. Now, this week's entry comes to us from Health Central, and it's titled, "The Latest Cholesterol Treatment Breakthroughs." So, Dr. Williams, what's new in the world of cholesterol?
That's a great question. So, as you and your guests may very well know, is that statin therapy has been well documented to show decreases in heart attacks and strokes in people who have elevated cholesterol. And it's probably been around since the 1980s. But we actually have some newer medications. One in particular, they're called PCSK9 inhibitors. They have long fancy names. One is alirocumab and the other is evolocumab. And they're injectable medications that we take once every 2 weeks. And it significantly reduces the LDL cholesterol when added to statin therapy. So we're really happy about that. And that is FDA approved. In addition, there's another medication called inclisiran, which is similar to the PCSK9 inhibitors. And what they do is reduce LDL as well. Now, that's only been approved in the European countries, and we're waiting for more data in the clinical trials now before the FDA approves it. The interesting thing about inclisiran is that you only have to take it maybe once or twice a year for the benefits. So we're really waiting for those clinical trials. In addition to that, there are other medications, something called bempedoic acid. Bempedoic acid actually is very like statins. They lower the LDL, but they actually do not cause the side effect that has been found in 5 to 10% of people, which is the muscle aches and pains that can be associated with statins. And finally, we have very potent fish oil, I'd call it. And there's something called icosapentaenoic acid, which is a medication to lower your triglycerides. So we have a lot of new things in cholesterol management.
That's exciting, and I guess hopefully our doctors, our individual doctors, will all be up to date on those, or at least we can Google that, and we'll be able to take that into them and make them be aware of what's going on in the world of cholesterol. So let's now get into our main segment with live viewer questions in You Ask, We Answer. As a reminder, while we are talking today, you can submit your questions in the comments section or submit them to heart.org/housecall. So let's get to it. Our first question comes to us from Keith in Hanover, New Hampshire. My doctor told me my cholesterol numbers, LDL, HDL, triglycerides. But what do all those mean? Dr. Williams, you were talking about LDL, but I don't know what all those mean either.
So LDL is low density lipoprotein, and it's a type of cholesterol that is made in the liver, and then it's actually transported out of the liver into the rest of the body and the tissues. And particularly when it's transported into the blood vessels, it can build up there and cause something called atherosclerosis. And so we don't want high levels of LDL. HDL is another type of cholesterol that actually brings the LDL cholesterol out of those tissues back into the liver and actually disposes of that. And so we want high levels of HDL. And then finally, triglycerides are the most common type of fat in the body that stores energy once we eat meals. So when we have people who have high LDLs, low HDLs, and high triglycerides, you're increasing your risk for heart attack and stroke.
Okay. Anita from Lexington, Kentucky asks, and this is a good one, what is the difference, the actual difference in good and bad cholesterol, Dr. Williams?
Yeah, so as I said, LDL cholesterol is what we're known as the bad cholesterol, because that can build up in the blood vessels and tissues and lead to increased risk of stroke and heart attack and even peripheral arterial disease. And good cholesterol actually clears the bad cholesterol out. The difference is also in the numbers as well, in terms of what the goals we look for. We want high levels of good cholesterol and low levels of bad cholesterol.
What about those triglycerides, though? Because we don't hear about those as much.
Yeah. So many times, several years ago, there were lots of medication that can lower triglycerides, but we weren't finding that those medications were actually lowering the risk of heart disease and stroke. But we actually now have, as I mentioned before, medications that not only lower the triglycerides, but actually lower your risk of heart attack and stroke. And so the triglycerides are the fatty substances from the foods that we take in each and every day. So what we talk about, fried French fries and pizza, all the great stuff, have a lot of triglycerides in them.
Real quick question here. Does water help clean out some of the bad cholesterol and clear out your triglycerides at all, drinking a lot of water?
Not generally. Certainly eating healthy, which is extremely important. Getting regular exercise and not smoking decreases your overall risk, as well as decreases cholesterol in someone who's otherwise healthy. And certainly water intake is good, but no, if your triglycerides are elevated, you probably want to move further with your healthcare providers to figure out why it's so elevated and what you can do to lower it.
Once upon a time, I was told I had high triglycerides and was told to drink more water. Okay, but that was a long time ago. Things have changed. Now, here's a question from Patty in Manhattan. Without getting tested, how would I even know if I had cholesterol? Are there any symptoms?
So that's the key. There are probably not a lot of symptoms at all. And the reason why I say that is because it builds up over weeks to months to years. And unfortunately, by the time that it's built up, for example, in the arteries, you might have a problem with poor supply of blood to whatever organ that is. If it's your heart, it can be heart attack. If it's your brain, it can be stroke. If it's your legs, it can be pain in your legs. So you don't want to get to the point where you start having symptoms. There are, however, rare people who have physical manifestations of high cholesterol. For example, they might have this what's called yellow plaques around the eyes. We call that xanthelasma, or plaques on the elbows and hands. We call that xanthomas, and that's often associated with a certain type of elevated high cholesterol. And so, if you have a family member or a friend who has that, certainly urge them to get their cholesterol checked. But for the most part, most of us, we do not see the signs of elevated cholesterol until it's too high.
Well, let's get to one more question before we take a break. And we're going to go to Marianne, and she wants to know what target cholesterol levels are recommended. Dr. Williams.
Great. So I will preface this by saying it's important to know your health. So in people who are otherwise healthy, there are certain recommendations in terms of the level of cholesterol. But if you have diabetes or actually known heart disease, the levels are a little different. So I will talk about people who are otherwise healthy. We generally recommend a total cholesterol of less than 200 milligrams per deciliter. And when it comes to the LDL, or the bad cholesterol, we recommend that is less than 130 milligrams per deciliter. The HDL cholesterol, the great cholesterol that we want very high levels, we recommend that's higher than 60. And then finally, triglycerides, we recommend that's less than 150. And again, as I said, when you have diabetes, if you have known heart disease, those levels are different and generally lower for the LDL and higher for the HDL.
Great discussion so far, but let's take a break right now for another poll question and hear from you guys watching at home. So grab your phone and get ready to text in your answer. And remember, all you have to do is text AHA live to 22333 to answer. And if you're already registered, you don't have to do it again. Or if you're joining from your phone and it's easier for you, just drop your answer into the comments. So here's our question. Which of the following contributes to heart disease? A, smoking, B, diet, C, genetics, D, little or no exercise, E, none of the above, F, all of the above. Sometimes, these kind of questions are easy to answer, but in this time, gosh, Dr. Williams, I'm going to need some help because I don't know, right now it looks like we're getting everyone saying 100% all of the above. Dr. Williams.
Absolutely. All of the above. Smoking, diet, genetics, so if it runs in your family, little or no exercise, extremely important. So all of the above contributes to heart disease.
What about genetics? Now, it's interesting because right now our viewer response, genetics and exercise, we're not seeing that as contributing to heart disease, does it?
Yeah, absolutely it does. There's something called an early family history of heart disease. Generally, this is in male first-degree relatives younger than the age of 55, or female first-degree relatives younger than the age of 65. We call that early heart disease, and that generally runs in families. And we think that is genetic-based. Little or no exercise, we do more and more studies looking at sedentary lifestyle increases your risk for many things, including heart disease. It increases your risk for high blood pressure and diabetes as well. So little or no exercise absolutely contributes to heart disease.
Well, and this last year of spending a lot more time at home, that's something we need to talk about or think about is the exercise, right?
Absolutely, absolutely.
Okay.
One thing that I've seen unfortunately, with this last pandemic is that I saw more people outside walking, safely and with, family members. And I'm hoping that actually continues. But yes, a lot of us have been very sedentary over the last year.
Okay, we still are getting some responses in, but so I want to just remind everybody that May is Stroke Awareness Month. Can't believe May is just around the corner. And of course, May is also the month of Mother's Day. So we have decided to focus on women's health as our way of celebrating moms who often put their health concerns on the back burner. We do hope everyone tunes in next week when we discuss stroke risks for women. Sometimes these are tongue twisters, aren't they? Now, here's a video that explains it further, so take a look. Okay, so taking a last look at our poll here, which of the following contributes to heart disease? We've got some smart viewers. The majority are saying all of the above, right, Dr. Williams?
Absolutely. There's some smart viewers, and hopefully they'll take this into consideration.
So let's get back to more viewer questions on cholesterol. And here's one from Bianca in San Juan. When should I get my cholesterol checked, and how often do I need to do it? Good question.
Yeah. So normally when you see your healthcare provider, usually over the age of 19 to 20, so I'm talking about adults, at least once a year, you should have your cholesterol checked. But if you have something like a family history of high cholesterol, perhaps sometimes that may be done more than once a year, perhaps twice a year. Or if you actually have been diagnosed with high cholesterol and you're on medications, for treating your high cholesterol, many times it's more than once a year, just to make sure that you're under good control. Your cholesterol is at the levels that they need to be. So at least once a year when you see your primary care providers, and certainly if you have elevated cholesterol, perhaps more than that.
Okay, Jerry from Mesquite wonders, what can I do to lower my cholesterol? We talked about exercise and what your diet, but she also wants to know, will I have to take medication?
So the premise of high cholesterol in terms of treatment is starting with good eating habits. So you're making sure that you have a good intake of fruit and vegetables, lean meats, poultry, and non-fried fish is always very good. Making sure that you're exercising routinely. What we recommend is at least 30 minutes of walking most days of the week, and not smoking are the bedrock of the treatment of high cholesterol. If on top of that you still don't have levels that are acceptable, then you might need to take medication. So it's not always, you may not always need to take medications, but if you're not able to get to the levels that are necessary, then you might need to take medications.
Angie in Provo, Utah asks, and I'm with you, Angie, on this one, high cholesterol runs in my family. So does that mean I'm going to have it too?
Not necessarily. Again, eating properly, exercise, not smoking is important, and making sure you know what your values are. So know what your cholesterol is. Make sure that you know that information. You don't necessarily have to get it. You are at a higher risk for developing high cholesterol and the potential complications from that. But if you are eating well, exercising, and not smoking, you're going a long way to reduce your risk.
And here is our last question. It's from Mick. What is the best way to reduce high cholesterol after a heart attack?
So I'm going to sound like a broken record. Making sure that you're eating well, you're exercising routinely, you're not smoking, but after a heart attack, faithfully taking your medications, which would include whatever cholesterol-lowering medications you would be placed on after a heart attack, is extremely, extremely important.
Okay, up next, we've got a pop quiz to test your knowledge on cholesterol with our interactive segment, Triple Trivia. Triple Trivia is sponsored by Crazy Cool Science. That's our new social media campaign that pumps up the fun in science. Science is everywhere, and crazy cool science proves it. We've got 3 trivia questions lined up to test your scientific knowledge of cholesterol. Drop your answer in the comments section or text in with your answer, and we will find out who's on their game today. Here's the first trivia question. According to the CDC, high cholesterol has what symptoms? A, swollen fingers. B, excessive sweating. Low tolerance to sweet food is C. D, none of the above. Okay, anybody been listening, Dr. Williams?
If I would like to answer that,
You want to? Well, D. Oh, look, I think we do have, people are listening to you.
There you go, D.
Oh, wait. Somebody there. We don't want to shame them. It's okay. But it is D. We don't really have any symptoms, right?
No, correct.
No. Okay, well, there is D, and 75% is okay. So many people don't know that their cholesterol is too high. But as you told us, Dr. Williams, it's that simple blood test, right? That can check. What isn't there? Is there a specific name? Like when you go to your doctor, you say, I want to have my cholesterol check, or what kind of a panel do you have to ask?
Yeah, we call that a lipid panel.
Okay. Why? What's lipid?
Lipid is kind of fat. As I said, cholesterol transports fat.
Okay. Okay, well, so good for the 88% who got that question right. Yeah. Next one. High cholesterol is a major controllable risk factor for what cardiovascular conditions? A, coronary heart disease. B, heart attack. C, stroke. D, all of the above. Okay, let's see if our viewers have been paying attention.
There you go.
Okay, nobody else answer. You're good. You're perfect right now. All right, the answer is D. And the other risk factors besides those that we see on the screen, Dr. Williams?
Also, peripheral arterial disease is a significant risk factor or disease that is associated with high cholesterol levels.
Okay, and of course, smoking, high blood pressure, and you did mention diabetes can increase the risk of cardiovascular disease.
Right, when it comes to risk factors, yes, correct. In addition to cholesterol, smoking, and high blood pressure, correct.
Okay, well, good. I'm glad everybody is paying attention because I certainly have learned a lot already. So here's our last trivia question for the day. Forget multiple choice. This is true or false. Cholesterol is bad for your body, true or false? You know, my first instinct is, Dr. Williams, even though we've been talking about it, is to say, really, cholesterol is bad. That's what we usually always hear.
No, and they're correct. Cholesterol is not bad. It's part of our body, but too much of it is a problem.
It's always too much of anything seems to be a bad thing, doesn't it?
Correct. Everything in moderation.
But so does cholesterol actually build cells, then, good cells that we need?
Yes, it helps to make the membrane of the cells that we need. So cholesterol has a purpose within the body.
Okay.
Yeah.
Well, I'll tell you what, I think that people have been paying attention because I mean, everyone knows someone, if it's not even in their family, who has or have had high cholesterol.
Right. And the important thing is for them to be able to get it checked and to know what their levels are. And to know what they can do to reduce the levels if they are too high.
Okay, we've still got a few people checking in, and we want to say good for you 80% who know that cholesterol is not necessarily bad for your body. So that's it for trivia. Dr. Williams, thank you so much for helping to answer these trivia questions and these viewer questions. And I think we've really got a much clearer picture of the role that cholesterol plays in our lives. Is there anything else you'd like to add before leaving us today?
I would just like to say thank you for the opportunity, and really just to emphasize to your viewership that exercise, eating well, and making sure you don't smoke, and making sure you know what your cholesterol level is important. And that's most of the information you need to live a healthy lifestyle in terms of heart disease.
Personal question, Dr. Williams. Have you ever had high cholesterol?
No, I haven't had high cholesterol. I've had the high good cholesterol because I actually run routinely. And that actually, exercise can increase your HDL. So yeah, I haven't had that. And I'm hoping to, I follow my advice routinely.
That's good to know. I have had high cholesterol, been able to control it with diet and working out. So I want to thank you, though, for making me feel better. And of course, all of our viewers feel better about our bodies. So thank you, Dr. Williams. And I'll tell you what, that does it for our show. And now we are all cholesterol literate. I hope we can all use this information to make healthier choices for ourselves. And of course, you can find any of our previous shows at heart.org/housecalls. Thank you so much for tuning in with me this morning. I'll see you next week. It's an important one, our Stroke Awareness Show. You take care. Bye-bye.
Learn more about House Calls, Real